Well, good afternoon. We are here at the Civic Plaza at Long Beach City Hall, and I am going to be joined by our health director, Kelly Colopy, in just a few minutes. But today is a really important day and a big day for the state of California, for all of LA County, and certainly for the city of Long Beach. We officially launch the next chapter of our recovery, and a really important day as it relates to just changes across the state of California. Now, we know that the pandemic is still with us, but we are embarking on what is going to be an absolutely new normal, a new way of moving forward, of being closer together, of not having capacity in restaurants and retail spaces, of vaccinated folks being able to be unmasked, and new rules that will be in place in just the weeks ahead as it relates to workers in spaces where they're working together indoors. And we'll hear about that in just a minute. Now, in Long Beach, we are at a great place. We have 99% of our seniors are vaccinated. That is an incredible number and an impressive number. We also now are at 67% of our 16-plus population is vaccinated, and we are moving towards our goal of hitting 70% vaccination rate, which is the goal set by the president and by the federal government. Now, because of the progress effective today, our public health measures locally will be aligned with the state of California. That includes removing physical distancing protocols, removing capacity limits at businesses. The county tiered system is, of course, now gone. And our director of health will go into some of the details in just a minute. And one of the other major changes is that we will now be moving into the building that's just right behind me here in the next weeks ahead. We begin that process today, where we will have our first city council meeting in person. It's been the first time that we've done so in the last 15 months. And then at the next meeting, we expect that the public will be allowed inside the meeting. And as soon as we hear from Cal OSHA on the exact rules around that, we will implement those. And city staff begin to be moving back into the building as well in the next couple of weeks. Want to first show a couple data points as we kind of wrap up this real important phase of this pandemic. The first graph, and I want to show a couple of graphs, shows the average number of cases that are represented by the orange line, hospitalizations, and the deaths in dark blue. You can see just the enormous progress the city has made. At the height of the pandemic, our average case rate was 739. We've dropped 99% to an average of 6 cases a day. That is a stunning change. During that same period, hospitalizations have been down 96%. And since the height of the surge, the positivity rate decreased 96%, and the case rate decreased 99%. If you look at the next two graphs, you can see that in the last 60 days, our case rate dropped even more, from 3.6 to 1.1. 3.6 was already significantly low. That's been about a 69% decrease. And our positivity rate has dropped in the last 60 days from 1.4 to 0.6, and that's a 57% decrease. At the height of the surge, we had 280 Long Beach residents that were hospitalized. We've had a 96% decrease on that. And Long Beach area hospitalizations went from 598 at the height of the surge to 11 today. That's a 98% decrease. We have lost 944 residents to COVID-19, and our love and prayers go to every single family and friend that has lost someone. But we have had also a significant decrease on those deaths. At the height of the surge, we had 87 deaths per week, and now we're averaging about 2. We also know the city's been just very impressive as it relates to its operation around testing and vaccinations. We have conducted more than 806,000 COVID tests. 254,000 residents have received at least one dose of the vaccine. And about 17,200 of these vaccines have been at mobile clinics. And as we look back, we know that we have had incredible progress. And I want to actually recognize 3 amazing women today. They are our behind-the-scenes team, but they are really the women that have managed the vaccine and the testing process in the city. And I want to recognize Tasha Day, Sandy Wedgeworth, and Gabby Hurtado, who collectively spearheaded the implementation and continue to manage the day-to-day operations of our mass vaccination clinics, at our mobile clinics, and at the convention center. These women are who you have to thank for when you talk about the success of our vaccination program and our mobile clinics, our testing. They led those efforts. I just want to thank all of you. You've been all amazing. So congratulations to you guys. Thank you all very much. And it's been an incredible journey, I know, for them and for all of us. We, believe it or not, the city has had 49 health orders throughout this entire time. The city's Joint Information Center has been incredibly involved every single day. And as a community, we've tried to keep everyone informed. I do want to thank just the media who's consistently also covered the pandemic, covered our press updates, and written about the pandemic to the benefit of the community every day. We were just doing a recap. We've had 92 of these COVID-19 press conferences, and I think we've answered close to 300 media questions just from this podium, not including all the questions that have been emailed during this time. This will be our last formal COVID-19 update. We started these about 3 days a week. Then we were down to 2 days a week, then one, then about every other week. We'll continue. We will still have updates, and we'll have press conferences as needed, but they will be less frequent as we move forward. And the Joint Information Center begins to wind down as well in the weeks ahead. We have now one important goal, and that is to hit 70% vaccination over the course of the next couple of weeks. As of right now, we are at exactly 67%. And so we need folks, if they want to continue to keep folks safe, if you want to ensure that your workplace is safe as you go back to work, if you want to make sure you're keeping your family safe and stay out of the hospital, the best way of doing that is to get vaccinated. Today, folks that are being hospitalized and that are facing serious injury or death, as being reported by the press, are largely folks that have been unvaccinated. So please keep yourself and your family out of the hospital and go get vaccinated today or any day in the days ahead. I'm going to now turn this over to our Director of Public Health, and then we'll also answer any questions. So Kelly Colopy, and she's done a great job of managing the pandemic for us as well. Kelly.
All right, good afternoon, everybody. Today we're celebrating an incredible Today we are celebrating an incredible milestone that we've been waiting for, the further reopening of our economy and the resumption of our everyday activities. Before I go into those updates from the state level and share how they will be implemented here in Long Beach, I'd like to reiterate the mayor's remarks on the city's response efforts and just thank you to all of our city employees and to magnify our health department staff for their endless contribution, sacrifices, and support in these last 15 months. Since day one, our health department staff has worked day in and day out, 7 days a week to keep our operations going. In total, we've had more than 300 new staff join us, either through 100 reassigned just in the health department itself, and over 200 newly hired employees that have supported the city's COVID-19 response efforts with thousands of hours of work. This left many of our programs without staff, and we are so glad that we were able to step in and support each other throughout this process. We have asked people to step into roles across the city. Many of these roles were difficult and uncomfortable for people, and yet they jumped in to support our efforts. I want to share a little bit about the health department's COVID story. In February 2020, we started tracking this COVID-19 virus, and as the mayor said, we declared an emergency in the early March. At that time, our health team was 5 public health emergency management staff and 5 in our epidemiology and surveillance, and this included our contact tracers. That's 10 people funded through grant funds to prepare for and step into a pandemic response. Our public health lab also did not have the supplies or the technology to begin the testing. As things started to move forward, our nurses stepped in to do the first testing at the health department once we had the lab capacity to run the tests. At that time, we cheered for the ability to do 25 tests. It was a huge milestone for us. Since that time, we've established systems that led to 22,000 cases investigated or contact traced, 76 outbreaks in businesses investigated, 120 outbreaks in skilled nursing facilities addressed, nearly 800,000 COVID tests provided, 2 temporary congregate homeless shelters at parks, a New Bridge housing location, as well as a Project Home Key, Project Room Key, an isolation and quarantine site for families and individuals without safe housing. We've also done nearly 350,000 vaccines administered, and now nearly 67% of our city has had at least one dose of vaccine. We also were able to get $20 million in CARES Act funding out the door in under 6 months to be able to support our community. These are huge accomplishments for a team that started of 10 people focused on communicable diseases and public health management. We now have robust trained staff for pandemic response that is funded almost entirely by federal emergency funding. These funds will end over the next couple years, and there's a good chance we could go back to our early self with our 10 folks under-resourced if the funding doesn't keep coming through. The California State Legislature has approved a $200 million funding for the public health workforce. This request is so important to our ability to support public health efforts outside of the pandemic response, such as our HIV and STD prevention and treatment, public health nurse visits to those who fall through the cracks of our healthcare system, and to our older adults, as well as maintaining an ongoing, trained, and robust capacity if we are to have another public health emergency. We do ask that the governor support this effort moving forward. It's so important to our ongoing work. Now it's June 15th, and all of our work at the health department and our incredible city partners has led to our lowest numbers since we first started tracking COVID cases and ensures we are comfortable moving forward beyond the blueprint. The new state health order rescinds almost all COVID restrictions, and Long Beach will align. Effective today, fully vaccinated individuals are not required to wear a facial covering, except in certain settings, such as healthcare settings, public health transportation, such as airplanes, buses, taxis, ride shares, and indoor K through 12 schools, childcare, and other youth settings, as well as certain congregate living settings, such as homeless shelters and detention facilities. Facial coverings remain required for unvaccinated individuals in indoor public settings and businesses. The CDPH also set guidelines for mega events. They're characterized as indoor events with more than 5,000 people or outdoor events with more than 10,000 people. Indoor mega events include conventions, conferences, expos, sporting events, and concerts. Verification of all vaccinated status or a pre-entry negative test are required for all attendees. And information must be prominently placed on all communications, including the reservation and ticketing systems, and to assure guests are aware of the testing and vaccination requirements, including the modes of acceptable verification. Outdoor mega events include music or food festivals, car shows, large endurance events, marathons, parades, sporting events, and concerts. Verification of fully vaccinated status or pre-entry negative tests is also strongly recommended for all for all attendees. Attendees who do not verify vaccination status should be asked to wear face coverings. Information must be prominently placed on all communications, including the reservation and ticketing systems, to ensure that guests are aware the state strongly recommends that they be fully vaccinated, obtain a negative COVID-19 test prior to attending the event, or wearing a face covering. While the state and city will continue to monitor the transmission and the effects of COVID-19 and its many variants, people should follow the CDPH's general public health recommendations. These include that everyone should get vaccinated when they're eligible. The indoor spaces should be well ventilated, like opening all the windows and doors to increase natural airflow, following the CDPH and California Division of Occupational Safety and Health, otherwise known as Cal-OSHA, guidance. Everyone should sign up for the California Notify as an added layer of protection for themselves and for the community to receive alerts when they have been in close contact with someone who tests positive for COVID-19. And if you have symptoms that you know are associated with COVID, please get tested. It doesn't matter if you've been vaccinated or not. We really want to make sure people continue testing so that they are not spreading to people who are unvaccinated. We've seen the number of COVID cases ebb and flow over the course of the past 15 months. It is our shared responsibility to resume our new normal as safely as we can to ensure we do not regress. While today we reflect on the progress we've made these past 15 plus months and celebrate the resumption of normal, everyday activities, we must continue to do our part so that we can continue moving forward. Your public health department will continue to provide testing, vaccine, and contact tracing to minimize any future outbreaks. I would just like to say that as your health director, this has been one of the most difficult years of my life. Excuse me. we kept hearing this is a marathon, and I kept thinking this is no marathon. This is an endurance race, and it has no finish line. Oh, and by the way, we're going to throw in some sprints and hills just to make sure that it's really long and painful. I have been an endurance athlete, and I understand what it takes to prepare, but you always knew where the end was, and we haven't known it this whole time. This is a proud day. I'm also so proud of my public health team. You got to see some of them here. Dr. Davis, Anissa Davis, your health officer, who you've seen many times up here, and our city for continuing to stand tall and to keep going when they're so exhausted they literally couldn't lift their heads, when the emotion coming from the loss of life was almost too much to bear. When changes kept coming, they kept adapting and excelling to serve our city. We have survived, grown, laughed, cried. We're still going strong. The event isn't over. I keep looking for the finish line, but our work is never done. This is the team that has made it possible, and I am so grateful for those around me, for the support of our mayor, our council, our city manager, and for all of our community partners and all of you, our community members, for getting us to this point. Thank you, and with that, I'll turn it back over to the mayor.
Yeah, if there's any questions for Kelly or myself, I'm happy to answer those. I do want to add one more thing, which I think we had a couple questions earlier today. It's really important for folks to know now that obviously, I think like most of us, we're going to continue to follow the science, and I'm looking forward to being able to be outside and feel more comfortable while not wearing a mask. But I also just want to make sure that folks know that there are still a lot of people that are still feeling anxious or uncomfortable. They may want to still continue to wear a mask, and I just want to make sure that those folks know that that's okay also. If you want to wear a mask, if you feel more comfortable, if that makes you feel safer, that's just another layer of protection, and I don't think anyone is discouraging that. But I think we also want to be clear that as a city, and certainly I intend to continue to follow the CDC guidance on masks and on all of the rules. And so I'm at a point where I feel much more comfortable, but I know that we want to provide that ease as well for everyone else. Any questions? So we'll determine that by listening to the health department and what and their advice to us. But we'll also be taking guidance from the state. But Kelly, did you want to answer that?
Yeah, I think it's important to recognize that public health has been doing this work for ever. It's the focus of the public health department to be able to do surveillance, to contact trace, to be able to mitigate. The original virus happened so quickly, and there weren't sufficient resources to be able to do that anywhere in the state or frankly the nation. But at this time we do have those capacities, and so we're really asking that people do get tested, that we be working with them, and that we can really keep things to small outbreaks if they do occur, so that we don't end up back into a surge process. At this time, we don't have markers for that process. Thank you.
Any other questions? Yes. Oh, man, I mean, honestly, I actually, today is one of the better days that I've felt in the last, 14, 15 months. I think that, I feel like an enormous burden has been lifted off of the state and the city as it relates to this moment that we've been really fighting to get towards. I think personally, I'm just very grateful that that the life of loss has dramatically decreased and slowed down. I obviously miss my mom very much. I miss my stepdad very much, but it's not unlike so many other people across the country. I think we have over 600,000 people that have died due to COVID-19 across the United States. Actually, that we just, I think, hit that marker. And my hope would be that we've learned from from the pain that those families have gone through, that we have to be better prepared for pandemics, that we have to listen to doctors and scientists, and that we have to lean into, doing the right thing. And I think that it took us a while to get there for a lot of folks, but we did get there. And for the vast majority of the country, I think it's done the right thing. And I'm just so thankful. I think when you look at the heroes, like the nurses and the doctors and the nurses assistants, these folks have really saved this country and saved our this moment, which has been the hardest thing I think we've probably all been through in a long time. So I'm just grateful to be here today. Thank you. Anything else? Okay, well, thank you all very much. Thank you. And we are going to have Spanish translation for Spanish.
Muy buenas tardes, gracias por acompañarnos. Hoy es nuestro último comunicado específicamente para COVID-19. Hoy es el 15 de junio del 2021. Hoy estamos en la plaza del Centro Cívico fuera de nuestras cámaras de consejo y el ayuntamiento, y nos acompañó el alcalde García y también nuestra directora de salud, Kelly Colopy. Hoy es un día muy importante para nuestra ciudad y también para el estado, ya que avanzamos oficialmente hacia el siguiente capítulo del viaje hacia la recuperación. A partir de hoy, se han removido varias medidas de salud pública puestas por el Estado durante la pandemia, incluidos los protocolos de distanciamiento físico, los límites de capacidad comercial y el sistema escalonado del condado, lo cual hablaré más adelante. Comenzaré compartiendo una actualización sobre los números de hoy y cómo se comparan con los de hace unos meses. Al día de hoy, 53,505 residentes de Long Beach han dado positivos por COVID-19. La primera imagen que se mostró enseñó el número promedio de casos diarios. En el punto álgido de la pandemia, durante el aumento repentino del invierno, la tasa promedio de casos diarios fue de 739 casos al día. Desde entonces ha caído un 99% a un promedio de 6 casos al día. Durante el mismo periodo, las hospitalizaciones diarias también han bajado un 96%. Desde el punto álgido de la oleada, la tasa de positividad disminuyó un 96% y la tasa de casos disminuyó un 99%. En los últimos 60 días, nuestra tasa de casos ha caído de un 3.6 que ya estaba bajo a un 1.1. Una disminución del 69%, y nuestra tasa de positividad se ha reducido en los últimos 60 días del 1.4% a 0.6%, una disminución del 57%. Los residentes de Long Beach hospitalizados pasaron de 280 en el pico del aumento a 10 a partir de hoy, una disminución del 96%. Y las hospitalizaciones en la área de Long Beach pasaron de 558 en el pico del aumento a 11. Recuerden que eso incluye personas que están hospitalizadas en los hospitales en Long Beach, pero quizás sean residentes fuera de esta ciudad. Esa es una disminución del 98%. Desde el comienzo de la pandemia hemos perdido tristemente a 944 residentes de Long Beach por COVID-19 y hoy se informa de una muerte más. Las muertes han disminuido a un promedio en el punto álgido del aumento de 87 muertes por semana a un promedio de 2 por semana. Se han realizado más de 806,000 pruebas de COVID aquí en la ciudad desde el inicio de la pandemia. Y hasta la fecha, más de 254,000 residentes de Long Beach han recibido al menos una de las vacunas, unas dosis, incluyendo más del 99% de nuestros residentes de 65 años o mayor, y el 67% de todos los residentes han sido vacunados. Y de ellos se han administrado 17,273 vacunas en nuestras clínicas móviles, de la cual hemos estado hablando los últimos años. Queremos agradecer a todos por los sacrificios que hicieron el año pasado y por adherirse a las numerosas órdenes de salud y protocolos de salud pública. Los números que están viendo hoy es el progreso que hemos logrado y se deben en gran parte a todos los que han hecho su parte para frenar la propagación de este virus. También hoy se reconoció a Tasha Day, Sandy Wedgeworth y Gaby Hurtado, quienes colectivamente encabezaron la implementación y continuaron administrando las operaciones diarias de nuestra clínica de vacunación masiva del Centro de Convenciones y también nuestras clínicas móviles. Se les agradece a ellos y también a todos los que han trabajado durante esta pandemia, las enfermeras, trabajadores de día a día aquí en la ciudad. Ha sido un viaje increíble para nuestros esfuerzos de comunicación y respuesta de emergencia. Y nos gustaría compartir con ustedes una descripción general de lo que hemos hecho desde el comienzo de la pandemia. El 19 de marzo del 2020, la ciudad emitió la primera de sus 49 órdenes de salud dadas para proteger la salud y seguridad de nuestros residentes, negocios y miembros de la comunidad. Esto incluye 38 revisiones de nuestra orden de salud Más Seguro en Casa y además de otras 11 órdenes de salud relacionadas con la cuarentena, aislamiento, las instalaciones de atención a largo plazo y otros temas especializados. Como parte de la gran respuesta de emergencia de la ciudad, en marzo pasado la ciudad activó su Centro de Información Conjunta, que ha continuado siendo responsable de todas las comunicaciones relacionadas con la pandemia y asegurando la diseminación oportuna y precisa de toda la información que ha salido al público. Al principio comenzamos a realizar conferencias de prensa transmitidas en vivo como esta, que se llevaron a cabo más de 3 veces por semana durante los primeros meses y han continuado durante estos 15 meses de esta pandemia. En total les hemos brindado 92 conferencias de prensa relacionados con COVID-19 que han brindado información y respuestas en vivo y en tiempo real. En estas conferencias de prensa hemos respondido a más de 300 preguntas a los medios. La información de salud dada en estas conferencias de prensa ha llegado a casi 2 millones de espectadores en todas las plataformas de medios sociales, incluyendo Facebook, Twitter, Instagram y YouTube. Nuestro Centro de Información Conjunta ha distribuido casi 100 comunicados de prensa relacionados con COVID-19 sobre temas como actualizaciones críticas sobre desarrollos de pruebas, órdenes de salud, protocolos de distribución de vacunas, operaciones y servicios de la ciudad, protección de inquilinos y también desarrollos de datos para garantizar que nuestra comunidad esté bien informada. El Centro Conjunto de Información también ha enviado más de 300 actualizaciones diarias de los medios a varios medios de comunicación locales y también de la región. Estas conferencias de prensa semanales ahora serán cuando sea necesario. Sé que hemos estado con ustedes semanalmente desde el principio de esta pandemia, pero ahora los comunicados de prensa relacionados a COVID-19 serán solo cuando necesario. Continuaremos siendo transparentes con las comunicaciones de nuestra ciudad y las respuestas oportunas al público. Como mencionó anteriormente, nos acompañó la directora de salud, Kelly Colopy, y desde el primer día nuestro personal del Departamento de Salud ha trabajado día tras día, 7 días a la semana para poder mantener nuestras operaciones en marcha. En total, 300, más de 100 reasignados y 200 recién contratados personal de salud han apoyado los esfuerzos de salud de COVID-19 de la ciudad con miles de horas trabajadas, lo cual dejamos a muchos de nuestros programas sin personal. Le hemos pedido a las personas que asuman posiciones en toda la ciudad. Muchos de estos eran difíciles, incómodos y sin embargo se unieron para apoyar nuestros esfuerzos. Ahora voy a compartir un poco sobre la historia de COVID del Departamento de Salud de la ciudad de Long Beach. En febrero del 2020 comenzamos a rastrear este nuevo virus llamado COVID-19 y declaramos el estado de emergencias a principio de marzo. En este momento, nuestro equipo de salud tenía solo 5 miembros de personal de manejo de emergencias de salud pública y 5 en nuestra epidemiología y vigilancia. Esto incluye marcadores de contacto, 10 personas financiadas con fondos de subvenciones para prepararse y dar un paso hacia la respuesta a una pandemia, algo mundial. Nuestro laboratorio de salud pública también tenía los suministros y la tecnología para comenzar a realizar pruebas. Nuestras enfermeras intervinieron para comenzar la primera prueba en el Departamento de Salud una vez que el laboratorio tuviera la capacidad para realizar esas pruebas. En ese momento aplaudieron por la capacidad de hacer tan solo 25 pruebas. Desde ese momento establecimos sistemas que llevaron a 22,000 casos investigados o seguimiento de contactos, 76 brotes en empresas investigadas, 120 brotes en centros de enfermería especializados abordadas y se hicieron casi 800,000 pruebas de COVID-19. Un largo estrecho de que empezaron con los 25. 2 refugios temporales para personas sin hogar. Se administraron casi 350,000 vacunas y ahora casi el 67% de los residentes aquí en Long Beach con al menos una dosis de la vacuna. 20 millones en fondos de la ley CARES Act para la comunidad para abordar los impactos de COVID en la ciudad y bienestar. Estos son logros enormes desde el comienzo de 10 personas enfocadas en estas enfermedades transmisibles y manejo de emergencia de salud pública. Ahora tenemos una sólida capacidad de personal capacitado para la respuesta a una pandemia que se financia en su totalidad con fondos federales de emergencia. Estos fondos terminarán en los próximos 2 años y volveremos al principio sin recursos suficientes para las respuestas de emergencia. La legislatura del estado de California ha aprobado 200 millones para la fuerza laboral de salud pública. Esto es muy importante para nuestra capacidad de apoyo, los esfuerzos de salud pública fuera de la respuesta a esta pandemia, como la prevención del tratamiento de programas como el de VIH, las visitas de enfermeras de salud pública a las personas que caen a las grietas de nuestro sistema de atención médica y a los adultos mayores, y un personal capacitado en forma continua, robusta capacidad de respuesta. Le pedimos al gobierno que apoye esta oportunidad. Durante la semana pasada, el Departamento de Salud Pública del Estado anuló muchas restricciones promulgadas durante la pandemia. Esas enmiendas entran en vigilancia hoy y también se implementarán en la ciudad, aquí de la ciudad de Long Beach. A partir de hoy, las personas completamente vacunadas no están obligadas a usar una cubierta facial, excepto en ciertos entornos como entornos de atención médica, en el transporte público como aviones, autobuses, taxis y viajes compartidos, y en interiores de escuelas desde kinder a 12 grado. Cuidado de niños y otros entornos para jóvenes y ciertos entornos en vida de congregación como refugios para personas sin hogar y centros de detención seguirán requiriendo esa cubierta facial. Sigue siendo necesario cubrir el rostro para las personas no vacunadas en entornos públicos cerrados y también negocios. El Estado también estableció pautas para mega eventos caracterizados como eventos en interiores de más de 5,000 personas o eventos al aire libre con más de 10,000 personas. Los mega eventos de interior van a incluir convenciones, conferencias, exposiciones, eventos deportivos, conciertos y deben requerir verificación del estado de vacunación completa o un resultado negativo de la prueba antes de la entrada para todos los que vayan a asistir. Y la información se colocará de manera destacada en todos los comunicados para incluir los sistemas de reserva y emisión de boletos para garantizar que los huéspedes conozcan los requisitos de prueba y vacunación, incluyendo los modos aceptables para poder verificar esa vacunación. Los megas eventos al aire libre también incluyen festivales de música o comida, exhibiciones de autos, grandes eventos de resistencia, maratones, desfiles, eventos deportivos y conciertos. Se recomienda a todos los asistentes la verificación del estado de vacunación completa o el resultado negativa de una prueba de COVID-19. A los asistentes que no puedan requerir eso, se le van a pedir que por favor usen cubiertas faciales. La información debe colocarse en un lugar destacado en todos, como mencioné, todos los lugares, incluyendo esos emisión de boletos. Aunque el Estado y la ciudad continúan monitoreando la transmisión y los efectos de COVID-19 y sus muchas variantes, las personas deben seguir las recomendaciones generales de la salud pública del Estado, que incluyen lo siguiente. Todos deben vacunarse cuando sean elegibles. Los espacios interiores deben estar bien ventilados, como abrir todas las ventanas y puertas para poder aumentar el flujo de aire natural, siguiendo las pautas actuales del Estado y de la División de Seguridad y Salud Ocupacional de California, conocido como Cal OSHA. Todos deben inscribirse en Cal Notify como una capa adicional de protección para ellos y la comunidad para recibir alertas cuando hayan estado en contacto cercano con alguien que dio positivo para COVID-19. Hemos visto la cantidad de casos de COVID-19 subir y bajar durante los últimos 15 meses y es nuestra responsabilidad compartida reanudar nuestra nueva normalidad de la manera más segura posible para garantizar que no nos vayamos a retroceder. Es muy importante que si las personas tienen síntomas de COVID-19, que por favor se hagan la prueba. Aunque hoy y eso incluye a las personas que también han sido vacunadas. Si tienen los síntomas de COVID-19, por favor, tomen esa prueba. Aunque hoy reflexionamos sobre el progreso que hemos logrado estos últimos 15 meses y celebramos la reanudación de las actividades cotidianas normales, debemos continuar haciendo nuestra parte para poder seguir avanzando. Para terminar, quiero leer un mensaje de Kelly Colopy, la directora de salud de la ciudad. Y ella dice: solo quiero decir que como su directora de salud, este ha sido un año difícil de mis 35 años de carrera. Seguimos escuchando que esto es un maratón y ella siguió pensando que se trataba de una carrera de resistencia, ya que no había una línea de meta identificada. Se le metieron sprints y grandes subidas construidas cada vez que sale algo nuevo. Ha sido un atleta de resistencia y entiendo que lo que se necesita para prepararse, pero siempre he sabido dónde estaba al final. Hoy está muy orgullosa de su equipo de salud pública, incluyendo la doctora Anissa Davis y toda la ciudad por continuar y seguir adelante cuando estaban tan agotados que literalmente no podían levantar la cabeza. Cuando la emoción de la pérdida de vidas era casi demasiado para soportar, cuando los cambios siguieron llegando y siguieron adaptándose y sobresaliendo para recibir a nuestra ciudad. Hemos sobrevivido, crecido, reído, llorado y todavía estamos fuertes. El evento aún no ha terminado. Nuestro trabajo nunca termina. Este es el equipo que lo hace posible. Estoy muy agradecida por quienes me rodean y por el apoyo de nuestro alcalde, consejo y administrador de la ciudad, y por todos nuestros socios comunitarios y miembros de la comunidad por llevarnos a este punto. Gracias. Este fue el mensaje de nuestra directora de salud, Kelly Colopy. Eso es todo por hoy y les agradecemos habernos acompañado. Como mencioné anteriormente, los comunicados que han sido semanalmente ahora solamente van a ser cuando sean necesario. Muchas gracias por acompañarnos y cuídense. That is all for today. We thank you for joining us. And as the mayor reminded everyone, these press briefings will no longer be on a weekly basis. They will only be done as needed. Thank you for joining us. Please take care.